Julio, a 20-year-old man from a low-income family, was born into poverty. He is the fourth child out of 6 siblings. Despite their poor circumstances, his parents were able to send him to school, but only until he graduated elementary, since his mother gave birth to 3 or more children in 3 years. He decided to continue his education by working 2 jobs to earn and save for his studies, since he desired to improve their current financial situation. He met Martes, who was also working in a small barbecue stall when he was in his 3rd year of high school. Martes is 17 years old and comes from a poor family of 8 children, with Martes being the 5th. She had only completed 5th grade in elementary school when she began working. Julio chose to live with Martes and have a family of their own without the approval of his parents, who, despite their difficult life, had high aspirations for their son as well. Julio and Martes built a small wooden house in a poor region of Barangay Maharlika, and their 5 children are unimmunized and malnourished. Julio worked from dawn till midnight to feed his family, while Martes stayed at home to take care of their children and occasionally did laundry for their neighborhood. Their 10-year-old second child, Inday, suddenly complained of abdominal pain one afternoon.
Oh, anak! Ano nangyari sa'yo?
Ay, sakit po ng tiyan ko. Kanina maputo.
Ala, saan man nalasakit yung tiyan mo?
Basta, sakit po.
Asan mo yung nanay mo? Marites! Marites! Marites!
Ano ba yan? Ano nangyayari dyan?
Yung anak mo sobrang sakit ng tiyan? Wala ka man lang bang ibang gagawin dyan?
Eh, ano, paano hindi magkakaganyan yan? Ano pinapakain mo?
Ito babae ito, puro kasi paganda!
Eh, paano yan? Wala tayong pera.
Anak, okay ka na ba?
Sakit po. Eh, yan kasi, yan yung sinasabi mo kasi ikaw yung naghahanap buhay. Eh, ako dito, naglalaban, nagmamanicure. Yan na nga yung ambag ko. Nag-aalaga pa ako sa mga anak natin.
Eh, anong gagawin natin dito ngayon?
Eh, paano yan? Wala na tayong pera.
Hoy kayong dalawa! Yung mga boses nyo, rinig na rinig dun kina Priscilla. Ano pa kasing problema nyo dyan at ang lalakas ng mga boses nyo? Uy, Mari, ano pa kasi nangyari kay Inday?
Hindi ko nga alam, Mare. Parang kanina pa masakit yung tiyan niya, tapos iyak na iyak.
O kumaring Francesca, ito kasing inaanak mong si Inday. Sobrang sakit daw ng tiyan. Di namin alam kung anong gagawin o saan namin dadalhin. Ito kasing kumari mo si Marites. Wala ibang alam, puro lang pampaganda.
Eh, ano pakialam mo? May maring tulungan mo nga kami.
Ay naku, Mari. Hindi ba kayo dumalo dun sa Barangay Health Education Campaign nung nakaraang linggo pa?
Saan ba yun?
Doon lang sa Barangay Health Center.
Pasensya ka na, Mari. Wala kaming alam sa mga ganyan. Sobrang busy kasi sa trabaho. Ito namang kumari mo, busy din sa paglalaba, pag-aasikaso dito sa bahay. Ayun, napabayaan na tuloy yung anak namin.
Huwag na kayong mag-alala at bilisan nyo na dalhin tong si Inday sa Barangay Health Center. At nang maipagamot ng libreng konsulta pa, lahat na.
Totoo? I-access mo ko ba yung kami, Mare?
Mari, naisabatas na yan. Kahit nga magpa-hospital tayo, malilibre nga tayo. Pero hindi naman lahat. Pero at least, di ba, may discount. Huwag na tayong magchika at dalhin nyo na si Inday dun sa Barangay Health Center. Kawawa naman tong inaanak ko.
Mari, maraming salamat ha. Dadalhin namin siya agad-agad.
Tara na.
Anak, kaya Kaya ko ba?
Kakayanin, Tay.
Magandang hapon po, ma'am.
Magandang hapon, ma'am, sir. Ano pong matutulong ko?
Ma'am, yung anak po kasi namin, si Inday, masakit daw po kasi yung tiyan niya. Di namin alam kung anong gagawin dun sa bahay o saan namin dadalhin. Buti na lang, may kapitbahay kaming nakapagsabi na dalhin daw namin dito.
I-check po muna.
Ko.
Sa ngayon, pain reliever na lang muna ang magbibigay namin dito sa health center. I-refer na lang po kayo namin sa Mariana Government Hospital para maagapan na ang kondisyon ni Inday.
Maraming
Salamat po.
Barangay health workers or BHW receive basic training to provide health services such as first aid, maternity, neonatal and child health, and community-based interventions such as immunization. If higher level health treatments are required, the primary care provider will refer patients or customers to the appropriate practitioner. Universal healthcare, also known as kalusugan pangkalahatan, is the provision of the greatest possible quality of healthcare to every Filipino in a manner that is accessible, efficient, equitably distributed, adequately funded, fairly financed, and properly used by an informed and empowered public. Last February 20, 2019, President Duterte signed RA 11223, or the Universal Healthcare Act, into law. The Universal Healthcare Act will benefit all Filipinos. The government will ensure that all Filipinos' well-being and health requirements, particularly those of the vulnerable population, are met. Health expenditure and shares of sources of funds in the Philippines 2005 to 2018. In recent years, government funds allocated for health have been increasing. As shown by higher national and local health budgets, the nation's total health expenditure and the National Health Insurance Program's benefit payments. But as the figure shows, OOP or out-of-pocket spending remains the nation's largest source of funding, accounting for 54% of the THE or total health expenditure in 2018. Additionally, according to data from the Philippine Statistics Authority, almost 1.5 million Filipinos are impoverished as a result of excessive medical expenses. Combined local resources from locally generated revenues, national transfers, and other external sources 2019 in million Philippine peso. Ratio computed as total national and external sources as a proportion of total funds, higher percentages mean greater dependency on funds that are not locally generated. At various governmental levels, the budget for healthcare-related initiatives and facilities are appropriated by means of municipal law. Devolution requires municipal governments to provide healthcare supplies for their own people. Additionally, devolution grants local governments the obligation to provide funds in order to support their own regional health networks, which they do through a municipal tax increase. 2019 will see domestically produced. The total revenue was approximately 207 billion Philippine peso. As illustrated in the figure, Local government units do not depend exclusively on their locally produced income. The majority of local resources still originate from national government fiscal transfers. Approximately 69% of the resources utilized by local governments originate from the national level majority, of which are directed through the government of IRA system or the international revenue allocation.